Fellow Kenyans, today, the 16th of April, 2020, marks exactly 1 month and 3 days since the first confirmed cases of the coronavirus disease was recorded in our country. As a government, and on the advice of medical and public health experts, we moved quickly to implement a comprehensive plan designed to limit individual exposure to the virus and its spread within our communities. We recognized the profound need for prompt action, observing the exponential nature of the pandemic's transmission that had been recorded in other countries across the world. The measures that we took are firm and indeed have been impactful. The nighttime curfew and the banning of travel in and out of the areas that have the most infections are indeed limiting the ability of the disease to be transmitted at a great scale. The same is also the case when it comes to social distancing. The guidelines that have been set out that include, amongst other things, the closure of learning and entertainment institutions, as well as the barring of air travel into our country. I want at this juncture to thank each and every one of you, all who have stepped up to be in compliance with these necessary measures, because your actions are, without doubt, saving lives. Without them, we would need to deal with a disease that is highly infectious and that can double and redouble its spread and cause untold human destruction. We have seen this happening in other countries. If we did not take strong and immediate steps, the damage to our people's lives and our economy, our country, would have been far worse than the current difficulties that we are going through now. Your compliance, fellow Kenyans, with distancing, wearing of masks, the hygiene advisories, these small and basic actions are protecting other Kenyans and even your own families. We love and respect our elderly fellow Kenyans, our grandmothers, our grandfathers. They are so vulnerable to this disease. So it is important that each one of us do the right thing and show our care for them by doing as our medical experts are advising us. Fellow Kenyans, our measures are slowing the rate the disease would be spreading, but we must be honest and say that there are still infections underway in nearly half of our counties. In the last 24 hours, we have conducted 704 tests, out of which 9 persons have tested positive for coronavirus. In that regard, the total number of persons who have tested positive now stands at 234. Fortunately for us, 53 persons have also turned negative and been discharged from hospital. We have lost 11 persons to this disease, and nearly 1,000 are still in quarantine, and 156 in isolation facilities. Fellow Kenyans, these are not just numbers, these are people, human beings. They range in age from 2 years to 64 years and come from every socio-economic group and multiple ethnicities and countries of origin. None of these people set out to be infected. We can all be infected if we are not extremely careful.